Hi, my name is Jenny Apekian. I'm a general dentist in Sacramento, California. I've been practicing for 10 years, and about 4 years ago I purchased my own practice. So now we've expanded. We went from a 4-op practice to 7-ops, and we were able to do a total digital integration here with the Sirona treatment centers. My first impression with the treatment centers was that they're very modern. They look space-aged, and it's a beautiful chair. More than that, when I sat down and I started demoing the chair, is really what made me fall in love. It was the integration. We can integrate the CEREC right into the chair. Endo is integrated. We don't have to have all that small equipment. Implant and the saline pump is integrated. It just makes everything so much more efficient, and I knew that efficiency was something I wanted in my practice. The patient experience has improved, obviously. Patients love coming here. They say that it feels like a Facebook or a Google rather than a dental office. The technology really has a wow factor, and the design of the office has that wow factor. When they sit in the chair, it's obvious that it's different than any other dental experience that they've had. We can pull up patient education videos right through the delivery unit. Patients love that feature and love being able to experience the technology firsthand. When we were in my previous office, when we had to set up for a root canal, it was the thing that my assistants dreaded most. You have to pull out this cart, roll it into the room, and pull out all this small equipment. Now we have the endomotor integrated right into the chair itself, and the apex locator is integrated. I can look straight up above me, and I don't have to turn my body to go look at the apex locator or grab another instrument. So everything is really, really ergonomic, and I love that integration. It is really the only treatment center on the market that is a treatment center. It's not just a chair. Patients can see that, and they could see they may not understand the intricacies of the technology, but they feel that there's something different here, and we're doing something unique and special, and they're able to enjoy the comforts that comes along with.
Hey, my friends, how are you guys doing tonight? We got Jenny and James in the house.
Yeah. Todd, I think we already had a sneak preview, didn't we?
Yes, we did. We got Jenny Apekian, and man, we are both big fans of yours. I am just absolutely amazed at your office. I mean,
thank you.
You've been walking around showing us all your art and everything. That's phenomenal.
Walking around. This is it in all its glory. Actually, I'll go to sterile since everybody's talking about sterilization right now. This is my sterilization.
Yeah.
And where the magic happens. Show you a little bit.
Well, tell us about your office. Like, how long have you been there, and what kind of technology are you putting in there?
I purchased an existing practice back in 2013 from a dentist, and the office was actually 3 blocks down from my current practice right now. And then I grew out of it relatively quickly, so I was looking for space, and I wanted to purchase a building. Found this building 3 blocks from that office, and that was in January 2017. We opened up here. We opened up with 6 fully equipped op with a possibility of 7th. Equipped that op within 6 months. And then just January of this year, we opened to 11 ops. So we added 4 more operatories.
Wow.
More non-clinical space. So it's a great space. I'm so proud of it. I have 2 wonderful associates, an amazing team of people, 4 hygienists. So I've got a really strong group here.
Well, to have a strong group like that, they need a strong leader. And I have a question for you. You're a mom.
Yeah.
You're an artist. You're an incredible dentist. How are you putting all this energy together, and how are you using that with this downtime and coming back?
Yeah, that's, honestly, I have a lot of energy. And,
I think so.
And I have a lot of passion. I love what I do. I really do. If you talk to anybody that works with me, they know that. I live, breathe, work dentistry. I feel like I have a strong vision. I always saw myself owning a practice that, had some key points that was very obvious in walking into my practice. So it's dentistry, art, and technology. And that's what the practice is all about. And I wanted people to kind of feel that sense when they entered my practice, that we're doing cutting edge dentistry. We're taking special attention in an artistic way. And that is something that I think kind of you can feel it when you enter the practice.
Have you gone through the reception area yet?
I was there. So this is all the new side. You can see there's no artwork here.
Okay.
The artwork is yours, right? You're the art.
So all the artwork in the
start showing us. I want to see the bull. Where's that red bull? Go back.
There's the red bull. Yeah.
This is the two sides of my husband. The raging bull and the calm, thoughtful bull.
I love it.
And then what I started doing in the last 6 months, I have succumbed to the fact that I'm probably not going to be able to paint enough artwork to get them up on these walls quick enough.
That's okay.
So I started purchasing artwork from local artists and trying to make that kind of a speaking point. So in all the treatment rooms, I've got, or starting to, I should say, I've got local artists' work. So this
beautiful.
is a local artist, Micah Crandall-Bear, and we have a little kind of information about him. And there's a little art community in Sacramento, and I love the fact that I can kind of talk to patients about something other than dentistry when they come in. I think that that's something that patients value, that kind of personal conversation, personal relationship. Here's another local artist. So I started doing that in each of the treatment rooms. So the common area, the artwork's mine, and the treatment rooms, I'm going to start doing artists in the area.
That great idea. That could be one of the most creative things I've ever seen.
Yeah, it's like
it really supports the community, and that's another thing I think that is a huge vision of mine, is to be, a part of the community. To help the community in certain ways, and some of that is supporting artists in the area, and we're always involved in this local art event called Chalk It Up, and I chalk up a square and donate to youth art programs in our area. So that's something I'm passionate about. So I'm always kind of thinking about ways I can give back.
Now, James is the philosophical one of us, but how in the world are you an artist and a leader at the same time? That's two sides of your brain you're exercising there.
Yeah.
I think I'm very happy that I really enjoy all aspects of having a dental practice, not just the clinical side of it, but I actually really do enjoy the business side of it, and I especially have grown to love the team side of it. I think when I first purchased the practice, I didn't really realize how much leadership is involved and how much management is involved in a practice. And I think our biggest asset, although I absolutely love my Prime Scan and I love my CEREC milling unit, I think our biggest asset is still our people. And if you can mobilize your people and really create a vision that they could buy into, you will see growth in your practice, and that's exactly what I've seen.
Well, let me stop you just real quick, because Gina Crippen says, let me move this, is an amazing doctor and beautiful practice. So happy to be a part of it.
She is. She's an associate of mine and a very close friend, so she's awesome.
Super. You're getting all sorts of comments. I think you know what? You broke the record to 100 hearts. You had that within about the... Oh, no, I'm not joking. James Klim has pink.
Mona, I'm like, Mona, you better comment comment because I'm definitely not as popular as you are.
You're already breaking the record, and
okay,
so
cool.
Anyway.
Oh, and let's just remind everybody to wait. I'm gonna turn this. Remember, just smile.
Yeah.
Oh, cool.
It'll all be okay. We're gonna be okay. We're gonna get through this. And this is my awesome. Look at my awesome office.
Hello. Hi. It's good to see you.
My sneeze guards. I don't know if you could tell. They're learning too. They're like they've got their face shields and they're not used to wearing masks and stuff. So they're getting used to their new normal.
Yeah. Well, tell us how you process this downtime. How did you orchestrate your team, the support of your team, and how did you communicate that? How are you communicating to your clients?
So, one of the things that I did, and this is before all of this COVID stuff happened, was I created a team Facebook page. And that's been a really great way to share because sometimes it's like you don't want to write a text or something that's, something silly that you want to, have people know about. And so we've just been able to communicate a lot through our Facebook page. I'll post pictures. I'll show them, some of the new equipment, PPE that we have in the office. So they've been able to kind of be a part of it and comment casually. Not in a very strict or regimented setting. We've had conference calls. We had a fun Zoom meeting where we all wore wigs and drank wine. And so, I always try to think about, I've been an employee before, and I just try to think about things from the perspective of an employee. And it's hard to do once you get seasoned as a practice owner. But I always try to put my feet in someone else's shoes and think about their perspective and how they view this current situation.
Awesome.
Yeah.
That's ways we've been able to communicate. And then as far as patients go, patients we do have a office Facebook page as well. And then we have emails for everybody. So we've been able to communicate with emails and just kind of social media. And, I think patients really want to know how you're doing. I think that's one thing we communicated is, we are closed, but we are open for emergencies. I have been seeing emergencies throughout this whole process. And, I was going in probably one day a week, seeing emergencies, and these are people that were, in dire need to see someone. And, I even saw a couple patients who didn't know where else to go.
Yeah.
And I feel equipped and ready to see patients. I feel educated, and I know that I and my team can take the necessary precautions as much as feasibly we can, short of quitting dentistry altogether.
Yeah.
I think that we are probably the most equipped to handle infection control.
Yeah.
So from that perspective, I've been communicating with patients, and, again, early on, we were able to order masks, and we donated, 1,000 masks to our local hospital. I think those kinds of, care and compassion you show in your community, it does help in, your relationship with your patients or how they view your practice.
Wow.
Amazing.
I'm so impressed with your
Wait. Go back. I want to see the phone. You got it. This is awesome.
Tell us
this
about the telephone.
Yeah.
I did a little shameless, you probably can't see it, but shameless plug. It's my phone number for my office in there. So if somebody's really paying attention, they'll notice it. Some patients have paid attention to that.
Now, how long have you been painting? Your whole life, or?
I've been painting for as long as I can remember. I have never been formally trained. It's just been something I really enjoy doing. In college, I was, in a very pretty tough science major, and I didn't have a whole lot of time to take any, classes outside of the curriculum. So I just kind of played with it, and I think in college is where I started actually paying more attention to painting. But it wasn't really until after dental school that I really devoted more time and attention to it.
Wait, go back. I want to see what's around. Go behind you to your left. What's in that room?
Oh, in this room?
This
show
is
some
stuff.
X-ray room.
Okay.
I didn't even say. So that's Orthofloss SLAI.
Uh-huh.
And I've got a little X-ray chair. This is my only tube head in the office.
Cool.
So I use nomads in the rooms.
Mm-hmm.
And yeah, that's my X-ray room. So we take a CBCT on all of our new patients, and then we replace our FMX with the CBCT, and that's we do employ that quite often.
It's amazing
Go ahead, James. Sorry. Go ahead.
No, it's amazing what we've learned from that. Todd, go ahead. You were going to ask how people perceive that.
I forgot.
Yeah. Well, I have practiced for such a long time, but when I got the 3D and implemented that in my new patient and recall care, that had a larger impact on my perception of people and their perception of the practice than any technology I've ever incorporated in over 35 years.
Yeah. So one of the things that when we moved to this new space is, number one, I invested a whole lot of money in technology, right?
Yeah.
So the technology in and of itself is really wonderful and great, and we get a lot of value out of that. But also, I think the technology can create a branding opportunity for your practice.
Wait, what was that? What was that? Go back. What is that?
What?
Is that a lizard? What is that? Sorry to interrupt.
Okay, so this is string art. So each little, you can see each little needle here.
Oh, beautiful.
This is string. So several years ago, my mom passed away from breast cancer, and she was a seamstress, and she left me, and I inherited all these kinds of, things that I had. I mean, although I sew, I was definitely no seamstress like she was. I inherited a lot of things, and I hated the idea of throwing these things away. And so I just try to create something out of what I got. And these are just sewing needles and string. And I just kind of created like geometric shapes. That's all. It's just kind of like an abstract. And then there's, you probably can't see it, but there's like a coating of resin. You can kind of see it's like mirror-like here. There's a coating of resin on top. So it's got this like really super high gloss finish. So I did another like string art piece that I did right while like on site. Actually, this is like a few days after my son was born. I came and I sat him down, propped him down just here with his car seat, and did the string art.
Amazing.
And actually,
that's so cool.
that was my son is my first child. I have a 1.5-year-old, and my son's 3 now.
Mm-hmm.
But when my son was born, he was born like I think it was a week before we opened here, a week and a half. So it talked about juggling a lot of things. That was juggling a lot of stuff. So yeah, I definitely find a lot of energy and excitement out of what I do. I think you have to be able to do it all.
I've always been impressed following you on Facebook, and I remember when you first got CAD/CAM in your office, and we met, I think, within the first month, and you showed me some of your cases, and those blew me away. Oh. Now I get it a little bit more.
Yeah.
Because you can translate artistry into reality in so many different ways, and it's mind-boggling to see the mix that you have both with your art, your vision, your leadership, and to be a clinician on top of that. And I think this is...
That means so much to me, because honestly, you're one of my dental heroes. And when you... I took a Jumpstart class, and that was my first, course, and that was with you and in Patterson and Roseville. And it really sparked like a serious interest in me that I didn't have before in that cosmetic aspect. And I really thank you for that. And I thank Sarek for that, just having that control.
Yeah.
We talk about that a lot, is having that control over your final product. I love that about Sarek. So.
Jenny, you're getting some love here. I gotta read some of these things. Gina Crippen says, "I never knew the story behind the string art. That makes me love that piece even more."
Yeah, so much.
And then Sarah Jochen says, "You're just amazing, Jenny. Always really enjoyed your company, but I am blown away." And, and we are too. Wow, just an amazing office. So.
Thank you.
And you know what's unique is I'm looking at what you're doing, and as someone who's practiced a long time, I'm seeing people that are coming into the thrust prime time of their career like you are, just thinking so beyond the box.
Yeah.
And that's really just watching you here. It encourages me. You're encouraging me. You're being a blessing to me and our audience, because I'm looking at what you're doing and I'm just going, oh my goodness, I don't think I've ever seen this before.
And I think that is something that would speak to this moment right now, right? Because I think I've always been accepting of change and inviting change, right?
Okay.
But I think the practices now that are going to thrive are the ones that, pivot, change, improve. And then I think they're going to do better than ever, to be honest, after all this, because, I feel like patients are now really almost hyper aware of infection control. They really want a practice that is doing the right thing. And if you can, create that niche in your community, then you'll do great. You shouldn't, I feel like there's a lot of naysayers, a lot of people who are worried. Dentistry is not going to go away. People aren't going to stop having toothaches and stop, developing caries or having gum disease. And we're important, And so I think that's the message I would say is, don't get in your, don't get on your Debbie Downer moment. Like just have faith and do things the right way, have passion, and you'll grow.
Mm-hmm.
So everybody out there, we asked Jenny to walk around because if you want to stop, you can stop. I mean,
I know now I feel like I have to.
One more thing. Have you shown everybody the pomegranate?
That's
out in the reception
amazing.
Area with the cow. Didn't they make a video on the cow picture? I think weren't you featured on that?
That was when I was painting the bull.
The bull, I should say.
Yeah, that was. Yeah, I guess I have a fascination with bulls and cows. I do have another cow I painted too. This is the pomegranate.
Hang on. I got to get her over. There we go. Okay, that is awesome.
So this is in our waiting room. I have people in line ready to purchase stuff, but I don't want to sell it. So I'm kind of thinking long term. I've always had this little dream to, create high quality prints of my work and sell it and create a charity for art.
There you go.
For art
great
outreach
idea.
in the community.
I got another. I got another shout out. Sorry, James. From Hannah Torrey. She says, she says, I like to walk and talk too. It's hard to sit around there sometimes.
Yeah. It is. I'm Armenian, so we tend to be very expressive, and so it's not that unusual to, walk and talk.
Well, Jenny, you and Todd have something in common because Todd does his photography, which is mind-boggling.
Beautiful stuff.
Thank you.
I don't even know how you capture those images. They're so pretty.
Yeah. And I'm looking at a lot of people in dentistry have these other hobbies, as I've gotten to know more dentists, that are very unique. And I think we're very privileged that we can have a profession that allows us to expand to be the best we can be. And you have definitely demonstrated that thus far in your career. I'm very impressed.
Are you an artist, James?
Well, my mom is.
Oh.
And I've kind of taken my art into dentistry, and then my greatest passion in life is in the media scene. Yeah. In fact, in dental school, I took a whole year of photography, and I loved the dark room and did a lot of black and white. But, as you grow through life, you kind of take care of the needs that come.
Yeah.
And, but, the passion you really come back to are the things that just entertain the right side of your brain. And
yeah.
Well, Jenny, sorry. Go ahead. I was just going to say, what is your favorite thing to do in dentistry? You just got out of doing a molar root canal, and then you jumped on the call with us. That's pressure right there.
I still love just cosmetic dentistry, like even just like a single central, as simple as that, or an ugly, like I love ugly teeth. If I had to
I gotta write that.
Ugly teeth all day long, like I love that. I love placing implants. That's like new to me. It's like I just did my second all-on 6 on an upper arch, start to finish, and that field is really interesting just because I feel like you make such a huge impact on a life, that it's so rewarding in that way. And from the clinical aspect, it's so interesting and dynamic, and surgeries can go any way, and it's that feeling that I guess I thrive in, that feeling of discomfort where you're just a little bit like out of your comfort zone.
Right on the edge.
Yeah. I love that. I love that feeling where, you're nervous, but then it comes out amazing and you're like, I did that. I love that about dentistry, that you have a final product and you can say, I made that, I created that. And patients, I think, when they can appreciate it in terms of their the impact on their lives, whether it's removing their pain or making them chew more comfortably, or, just not dealing with the issues that they had before. I think that's wonderful about dentistry.
Wow. What a beautiful combination. Todd.
Yeah, go ahead. Well, I was just going to say, Jenny is part of the Epic Ladies, right?
Yes, right. The Epic Ladies are wonderful. I wish I could be much more involved, but at the time, I just had my daughter. Yeah. So I think I'm coming out of the fog that is infancy. And, my kids are sleeping now, and I've got one out of a diaper. I think I'm like starting to see the light. And so hopefully I can be more involved. But this has been a very challenging thing for me in the last couple of years to balance being a mom and having to say no to certain things that I really do want to do.
Right.
Because if I could do it all, I would.
You're doing 10 times more than I did today. That's amazing.
Well, I was impressed before today. Now I'm blown away, just like Sarah said. No, I'm saying that because I really mean it. Because when I see this type of energy, it actually puts energy back into this guy who's been practicing for over 30 years, and that's why I like to even teach, is because I actually get energy from it, and I learn from it. I could sit in your office and watch you for a week and learn a lot. I can tell you that already.
I don't know about that.
I really appreciate what you've shared today. Todd, I've been blessed again.
Everybody's great. I would love to know how to do string art. That looks really cool.
If you're looking for something to do during quarantine, that is the thing. It is like just, that's what I love about art. It's like you can just lose yourself, and it's just kind of this mindless thing, and and then all of a sudden you have this thing you created. And so it's really, I feel like that part of art and dentistry is so similar in creating something and having an outcome that is yours, right?
Yeah.
And so that's how I see the parallel.
Just amazing. I can't wait to see your practice. I'm coming. I'm going to pretend I have a toothache.
Yeah.
What
have
James,
you all done during quarantine? What do you feel like you've accomplished?
You know what was funny? I'm actually I'm back in practice. So we've had 2 days already, and James and I were talking before we started the webcast that the hardest thing for me to get back into it was focusing through my loops.
Yeah.
Because I hadn't worn them for 6 weeks, and then I put them on, and I was having to get my posture and everything back.
Yeah.
And anyway, it all came back. You'll be all right.
Loops over an N95. I couldn't tolerate it. It was just
really?
Like on my face.
Yeah.
Yeah.
I don't think that a lot of the I'll just have to say, all of the precautions that we're doing, I guarantee you just about every dental office is going to go about a week, and then they're going to go, I don't know if we can do this. That's unrealistic.
That's exactly how I felt when I was wearing the N95. I mean, actually, I kind of like the face shield. I don't know if I just started using that because I just got them finally. So I didn't mind. I don't mind the face shield. So what I decided to do is make mask fitters for my whole team. So we 3D printed mask fitters.
Right.
Okay.
And so that has been much more comfortable for me to wear than an N95. And we'll see where this goes. I mean, the virus needs to get in somehow, right? So if we're really cautious and we're, using all of our PPE effectively, I think that, we should be able to be safe.
Yeah, I think we will be. And there's a lot of information coming out now with immune studies that show that a lot of people have the antibody and never had symptoms. And I think when it's all said and done, I think any disease is bad, but I think we're going to be in a better place than maybe some of the hyped up fears that could have been. And it could have been bad, and it still is bad.
Well,
if you lose a loved one from this, it's bad.
Oh yeah.
Or if I die, it's bad. And unfortunately, disease happens. I have a brother who's a physician, so I have a little different mindset on it.
Yeah.
But we still want to be safe and keep our clients safe and keep their loved ones safe and not take something home to the ones we love.
Absolutely. Yeah.
So Jenny, how are you? I know you're communicating with your team. What are you feeling and sensing from your patient base? Are they ready to come back, or? So
I think the majority of patients seem like they want to come in, but we have some that want to come in that really shouldn't come in because they're very high risk, and then we have a group of people that don't want to come in, and it's in the minority. I would say, like, I've asked my front office, what's the sense you're getting? We're thinking about like 10-15% of people aren't quite ready. Everyone's saying, but schedule me in June, but we have no openings in June. So I don't know. I think that this is a matter of a few more weeks that people will kind of get some comfort in time. And I think it'll resolve at some point soon.
Sure. Well, we're going to be up and going because that's our culture, right? We find a challenge. We find a way to get around it. We move on so we can stay in this beautiful land that we live in.
Yeah.
You know how we're going to move on right now?
How?
We gotta ask for more hearts. I'm not turning this video off till we get to 1,000, and I'm watching them.
Oh my gosh! Come on.
I'm just gonna say, look, my hands are they're tied. I'm not pushing the off button until we get to 1,000.
I'm gonna brag to Mona that I got more likes than she did. I'm so excited.
Well, the ladies are supporting you big time. You got a lot of people.
Oh yeah.
You got a lot of fans, and
I'm gonna be with you next Epic meeting for sure.
Yeah. Yeah. Well, you folks bring a perspective to our unique niche of profession that I think is very healthy. And I like what you guys are doing. You're raising the bar.
You mean Epic Ladies?
Yeah.
Mm-hmm.
Yeah, it's such a supportive group of women. And I think women in general, try to support each other. But this particular group of ladies I think it's just when you get like-minded dentists together, it's very invigorating. I'm sure you guys agree, where it's like you just have these passions that are similar, and you can you feel like, here's another person that gets me. But
sure,
then
and
you add the female aspect and the mom aspect and whatever else, and it just an extra level.
It makes a very complete circle.
Yes.
And I see that, and I really appreciate it.
Mm-hmm.
Jenny, will you say one thing? Let's just be self-serving here right now. Just say okay. I need 300 more. Just say that.
Oh.
Just
I need 300 more likes right
now. Well, it looks like you're getting them. So, this has been fun. I have loved watching you walk around your office. It's just an amazing place. Yeah.
I took a seat in my consult room.
Yeah, I see.
Oh yeah. Here, hang on. Go back. Show us that again.
Consult room.
And what is the wood piece that's at the top up there?
It's just I did the, I guess, design of the office.
Uh-huh.
And I just tried to create some kind of natural element in the office, because it can look a little modern and stark.
Mm-hmm.
So just something decorative.
Wow.
That's all.
You just make it sound so easy, and your attention to detail is definitely obvious. So anyway, beautiful place. Okay, so Erin Elliott just says, let me move her here. Here we go. Erin Elliott says, Jenny Apekian rocks. I've had the privilege of visiting in person. Her art is amazing. She made it. Yep. So you got a lot of love going on.
Aw, Erin's awesome.
Yeah,
she's got an infectious personality for sure. She's so much fun. I love Erin.
Yeah. Well, you guys are moving our profession, and I'm a fan of it, and I love it.
Yeah.
So Jenny, with all that you've done, I mean, this office and the kids and the bull husband. You're managing. He knows now, I think. You're managing so much. What are you dreaming for? I mean, it seems like you've got the dream life, the dream practice. I mean, what is your next step?
I mean, it's not to say I don't have challenges. Of course I do. But, I always try to think of every challenge like, what is my part in this and what can I control? And if there is something I can control, how can I make it better? Mm-hmm. So if you can flip your outlook into the, how can I actually learn from this, and how can this challenge serve me? I think that's what I try to do all the time. So it may look like I've got an easy breezy life, but let me tell you, 2 kids under 3 and a practice of, 16 individuals and 11 operatories is not easy. It does have its difficulties. I just don't choose to look at it that way, if that makes sense.
Yeah, it does. That mindset will take you wherever you want to go.
Yeah.
And I think in my career, and I'm in my 4th decade now, and every decade's been a little different. But one thing I love about dentistry so much is that you can recreate yourself to interests that you develop as technology comes, as you look at new interests. But some of my interests have changed through the years, and what's nice about dentistry is that you can pivot, and you've mentioned that. I mean, you've got all the ingredients there. I'm looking forward to following your career.
Oh, thank you.
It's going to be a lot of fun to see, and having leaders like you in our community will help others think bigger, and reach further.
Yeah.
And as a result, we all benefit from your story and the story that you will create from here on out.
Thank you.
I'm just having fun because I'm watching this on Facebook as we're talking, and we're almost to 2,000. Come on, people. We got to get to 2,000. Oh, my gosh. You ladies really support each other. And James and I have really enjoyed getting to know you guys, girls. And we're going to go to the Epic Ladies in November. Where is that?
So you're actually attending?
Mm-hmm. Yeah. I'm going to wear a skirt. I'm going to wear a skirt and my high heels. I think I'll fit in.
Yes, I love it.
Anyway, well, you've got a lot of fans out there, and we really appreciate the time you took to walk us through the office. You're an amazing person, and I apologize that I said your last name wrong last night.
No, it's totally fine.
But with all the fans that are watching right now, you got any last words of hope and how you're going to get through all this?
I think, like I mentioned, it's just about, turning the conversation around, making this challenge into something that you may be able to actually, come out ahead on. Sadly, there are going to be dentists out there that are, seeing this as a major negative, or those who were already struggling. Maybe they won't come through out of this. And I hope that's not the case. But if it is, how are you going to have an edge in your field? What is it you're passionate about, and how can you bring that into your practice for the benefit of your business, right? Mm-hmm. And I think that is something I would just encourage people to think about is, how are you going to come out on the other side of this, and what do you want to, what kind of dentist do you want to be? Amazing.
Yes.
Awesome. You got over 2,200. They're still coming. 400. You're like you might beat the record, I think.
Oh gosh.
I guess the only thing to ask you, as being one of the Epic Ladies, you got to do the shuffle.
Oh no, not doing it. No, I am not. That is like, I'll stick to hand skills and art. I'm not a dancer.
No, we're getting a lot of pressure to do the shuffle.
Well,
Shivy is especially after seeing Shivy, I'm not doing it. It's not happening.
Well, you dance through your art, and that's
thank you.
That's only something you have. So that's beautiful.
Well, Jenny, thank you so much for spending the time with you. You're a blessing and breath of fresh air. I'm inspired. I'm going to start printing more of my photography and get it up on the walls.
Yes,
that's really.
Yes, Todd, you need to do that.
You really should.
I've got a few.
Beautiful. You do a very nice job.
Thank you. I appreciate it.
Yes.
You know what? I would love a piece of your art, and I'll send you one of my photography or my Milky Way pictures.
Oh my God! Do you know
how many
balls I have in my practice?
I'll be glad to send you something. Let's talk afterwards, okay?
Okay, for sure.
All right, awesome.
Yeah.
See, this was meant to happen.
Yes.
Yeah, Mona says you got to do the shuffle, but I told her no. No,
nope.
Okay.
Not doing it. I don't care what she says. Not happening.
It's just part of the love.
Part of the love. You got 2,500 hearts. Thank you.
Aww.
Thanks,
Thank you,
Jenny.
guys. This was fun.
Thank you.
Awesome. Thanks so much.
Bye.
Bye. Wow. James, I am blown away because we've had some of the best guests ever, and they're all unique in their own right. And that was awesome. I had no idea she had that kind of artwork in her office.
Well, you know what I admire about having the ability to be artistic, which is the upper right quadrant, and also to be a leader, which is the upper left, and then pay attention to detailed, which is lower left, and then to be able to connect with people on lower right. That is a very unique combination, and it all came through there. Just the leadership and the vision.
When she said she had 2 kids under 3 and then managed that big practice, I don't know how that can be done and still be artistic at the same time and handle a molar root canal and walk on to Skype and get on with us. I mean, that's pretty impressive.
Well, we've been blessed, haven't we? And our audience has been blessed. We want to ask you to share this webcast.
Yeah.
Or I should say Facebook cast. Share it with other people. Other dentists need to see this. They need to be encouraged. And that's one thing that you and I wanted to do from the very get-go, was to encourage others. And I find that I'm the one being encouraged the most.
This is my favorite thing to do in the day, so I'm really inspired. But you know what? While she was walking around doing some art, I did some art too. Let me show you what it is. So I drew this. This is my Texas art. Oh no, that's not really art.
Well, but I understand why you appreciate those circles.
Yeah, well, we gotta shoot things, so that's what we do down here.
I know.
James, you got a deep thought to wrap us up?
I think we've already been blessed more than we could have imagined, and we're looking forward to tomorrow. Our buddy, Dr. Mark Fleming, is coming on, and we have who are some of the other ones we have throughout the week and next Sunday?
Oh, well, this is a big week. I mean, Jen, she has set the bar for the rest of the week. That is for sure. So, Mark Fleming, you better come with your A game tomorrow, buddy. But we got Mark Fleming tomorrow, and then Tarun T-Bone is coming on Friday, and then we've got the funniest guy in dentistry, bar none, is Mike DeTola. I can't wait to talk to him.
That's Sunday evening, isn't it?
Yeah, Sunday evening. And for those out there, I'm taking requests. I've got a lot of other people lined up for next week. So if you're interested in being on our show, let us know. And like James said, you share this, because we're just a small community, and we all need to be friends and partners through this journey. So James, why don't you wrap it up for us, buddy?
Well, we are blessed by others. We're blessed by being inclusive with one another, and it helps us think better. And as we think, so does our heart go. And that would be my challenge to anyone who's struggling right now. Think about what others are doing, get some encouragement, and you're going to be just fine.
Amen. Thank you. Thank everybody for watching tonight.
Bye. Bye.